Hello, my name is Michael Sherar and I'm the President and CEO of Cancer Care Ontario. I think the real challenge is using that data intelligently, linking it together around individual patients and understanding how we can improve the journey of those individual patients and then use that to improve the system as a whole. So there's a tremendous amount, I think, of analytics, integration and innovation with respect to information that's actually going to lead to value, and I think that's our challenge. I think the most important thing we can do is ask patients, and we're doing that. We're starting to do that in a number of ways. We have them as part of our groups that we work with in terms of how we're going to design systems that better respond to patient needs. We have electronic methods of getting information from patients, whether it's around their pain and symptoms during treatment, their experience of the healthcare system. And we're finding that that's tremendously valuable in looking for ways to improve the system and to involve them in their care, which I think leads to better outcomes, better value for the health system. So the first thing we need to do is ask patients. Yeah, we need to ask both. It's very important, for example, if we're trying to make sure that people access our screening programs, they're not sick, they don't have a diagnosis of cancer, they're maybe very well, people, you know, my age or younger who don't have a chronic disease now, we want to make them aware. And we want to make sure that they participate in screening programs where it makes sense for them to do so, whether it's breast, cervical or colorectal cancer screening. So we need to ask them how best to provide them the information. How can we reach out to you so that you understand what are the benefits, for example, of screening, what you can do around prevention, risk factors in your own life, whether it's smoking or alcohol, your level of physical exercise, what you eat. These are the major risk factors for chronic diseases. We need to reach out to people and so that we can provide information in a way that's helpful to them. So it's not just people who are sick, it's everyone. I would say we're on a journey in terms of information. We learned about that this morning in terms of just a huge amount of information that is available and that we can use, and how can we use it. So I think the culture of innovation, of leadership that we're seeing with all of social media, we need to harness that. And I think the culture of leading, being innovators, of using that information, gathering that information, we need to do that in healthcare. And I think if we can promote that culture through a day like today, that will be a success. Well, privacy is tremendously important. Patients and the public are concerned that private information remains private, and we have to be able to respect that, and so that we do have to have very good ways in which we can both use information for individual patients and for the system, but at the same time as protecting that privacy. And this is a huge issue not only in healthcare but more generally, as the abundance of information, a lot of it self-generated, is online, available. And then we have all kinds of information in doctors' offices and hospitals. So, you know, the challenge is how do we integrate all the power of all of that data in a way that protects people's privacy. And so certainly we as an organization are very committed to all of the work to see how we can be innovative around that, how we can use information intelligently at the individual patient level, at the system level, at the same time as protecting privacy. It's going to be an area of development and innovation, and needs creativity just as we do in actually the use of information. And so that's a big effort for Cancer Care Ontario as well. Opportunity.